Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. My name is Lex Frieden. I'm professor at the University of Texas Health Science Center at Houston, and I'll be your host for today's program. We have a wonderful guest here to talk about an important subject, and I'll introduce him right after I ask you this question. This is a question that we'll answer before the end of today's program. How many people with disabilities and chronic health conditions were evacuated from the Houston area prior to landfall of Hurricane Ike? That's a good question. We'll answer it before the end of today's show, and a person who can help us answer that question is the Deputy Director of the Emergency Management Office of the City of Houston, Terry Moore. Terry, welcome to Focus on Abilities.
Oh, Lex, thank you for having me.
Terry, your job is vital to the lives of a lot of Houstonians, and on the other hand, you work in a kind of a private building out of the mainstream. I've been there before. It's surrounded like a bunker. Not many people will know what you do there. What is your job exactly?
Well, emergency management for the City of Houston is a very behind-the-scenes activity. Majority of our time is spent, much like today, doing planning or education, where our responsibilities are making our community more prepared and ready to deal with disasters that come up and face our citizens.
So on a day-to-day basis, you'll be meeting with community groups, public officials?
Absolutely. It ranges on a day-to-day basis from community leaders, community organizations, focus education presentations. Friday I attended a presentation at St. Thomas University about the weather and the preparedness from Hurricane Ike, looking at the meteorologic side. So there's some science to it, there's human behavior to it, there's political science to it, and it's a great career that is very challenging to stay in tune with.
Well, I want to get to what we do in Houston about emergencies, but before, you've raised an interesting point about the skills that one must have to function in the job that you have. What could prepare a person for helping others prepare for disaster?
Well, a lot of what we do is learned skill. It comes with experience, unfortunately. There's some great degree programs that have really taken off and are becoming more common practice in teaching individuals how to conduct emergency preparedness programs. One of the premier study areas is the bachelor's program at the University of North Texas for emergency management.
Mm-hmm. Your graduate background, where did you go to school?
Well, I'm a graduate of the School of Hard Knocks, unfortunately. I've attended school in the University of New Mexico and some North Harris Community College here, but the majority of my background comes from just being in the community and helping people. I did 15 years in the fire service in Albuquerque prior to moving to Houston shortly after the Tropical Storm Allison event in June of 2001. Since I've been here, my entire background has been in emergency management, and I've had the opportunity to learn a lot about the disasters that occur here and how resilient our community is and the citizens at getting back on their feet following a disruption.
Well, let's talk about that a little bit. I mean, the best thing I guess our community can do, or we can do as individuals when we think about disasters, is be prepared.
Oh, absolutely.
I mean, it's inevitable in our community that we will have disasters periodically.
Yeah, when you look at Hurricane Ike is the 35th presidential disaster declaration that has been given to Harris County. Wow. Now that doesn't seem like a lot, but when you take that number of 35 and you compare it to the number of states and how many presidential declarations that other states have had, Harris County has had more presidentially declared disasters than all but 7 states.
Wow, that's amazing.
That's a pretty significant statistic when you think about it, and it gives our community a great opportunity to be prepared for disasters. And that's why Houston is such a disaster resilient city. We get back on our feet very quickly.
Well, it's also true that other cities pattern their response after Houston's. I mean, we're sort of looked at as a model for other cities, particularly along the Gulf Coast and as it relates to hurricanes, I think.
Absolutely. We never stop learning, and that's probably one of the keys. You've taught me some great lessons in dealing with this population specifically. From an emergency management perspective, we look at individuals with disabilities as a very significant challenge for us, because it would be very hard for us to assume 100% of their care. And one of the things that you've taught me in our interactions over the last few years is that local emergency management programs don't have to assume 100% of your care. We have to focus our abilities on the continuum of supporting what you can do for yourself and empowering your ability rather than focusing on the disability.
Well, if you break disaster down and response to disaster, you start with preparedness.
Absolutely.
Then at some point you have an event, presumably, and you have an immediate response to that event. That's something where people sometimes lose control depending on the degree of the disaster. You assume a greater role then than perhaps any other entity. Following that, then there's a recovery process, and this is a process that everybody gets involved in ultimately, and to the extent that people are able to recover, some need support more than others. Others, as you pointed out, are quite resilient and able to recover very quickly. Our community as a whole seems to have learned resiliency and how to recovery, given the experiences we've had. And preparedness, we seem to have managed that better now than ever before.
I agree with you, Lex. Our preparedness efforts have significantly improved. We're doing more and more each year, and that outreach continues to see success. But what you do see is a disaster amnesia. As we get further and further from a disaster event, people's level of preparedness and commitment to preparedness diminishes. And the area of the upper Texas coast doesn't afford us the luxury of complacency. We have to stay ready to respond to disasters year-round, and that's everyone from federal, state, local elected officials, local emergency management programs, all the way down to our CERT volunteers and our individual community.
Well, you pointed out a good issue, and that is you called it amnesia. I think there's also a conditioning process involved, because sometimes we prepare for an event which sort of fizzles, and that then causes people the next time around not to be as concerned as they perhaps ought to be, because the next event may be more than a drill. And I think our public officials, you all in the Office of Emergency Management, Sharon Knowles, your other colleagues, have done a good job sort of working with the public officials to help them manage the opinions of the public and the media about preparation, despite the fact that a prior event may not have been as big as the next one will be. People seem to be getting that and understanding that and preparing, despite the fact that if luck is with us, we won't get a big blow, we'll get a little blow.
That's exactly right. You hate to be in the business of hoping the disaster goes elsewhere and hurts someone else, but you're glad to see that your preparedness efforts worked, that your community was ready, that they responded appropriately, and you get to see the fruits of your labor.
The biggest issue for people with disabilities, there are many big issues, but I think the biggest one is probably evacuation if there's a need to evacuate, because most of us don't have independent means of transportation.
Sure.
Families sometimes aren't able to provide the kind of evacuation assistance that's necessary, and we do have now a functional 211 system where people can register.
Absolutely.
How's that working, Terry?
Well, we've still got a gap. The Transportation Assistance Registry, which is accessed through 211, which has a much broader focus, this is simply one of their tools in the toolbox, is a tremendous gateway to where individuals can register for assistance that they might need during an evacuation. And what we've seen is consistently a population of 6,000 to 10,000 people that will register each year. We've done this now 3 years, but we know the population that's out there that may require assistance is probably 4 to 5 times the number of what we're getting registered.
Right.
That creates a huge gap in emergency management and emergency preparedness planning, because the only way we're able to adequately prepare is to understand what the demand and what the need is going to be.
Well, you can prepare best if you know who it is, where they are, and when they might need help. But in our society, it's unlikely that you're going to get all that data. So given that, then, if you have a good idea of the numbers and a general idea of where people are located, you can do better than if you have no information at all.
Absolutely.
In this case, basically what you're saying is that you may have 20% of the information you need even to have a modicum of success in the worst case scenario. Now, in the case of Ike, we were able to evacuate, I think, roughly 3,000 people, many of those people to San Antonio, people with severe impairments and disabilities and chronic health conditions that needed to be out of the harm's way. That was done very efficiently. Do you credit that a lot to the pre-registration?
Well, the pre-registration was a big success from that regard. It gave us a good understanding of who the population was and what their needs were. By having the information up front, it allows us to assess the number of ambulances that we're going to need and how to best prioritize those, the number of paratransit vehicles that we're going to need and how to prioritize those, and then the number of long-haul coaches or buses that we'll need to move this population out of harm's way. The big gap comes from not having information. And this program is very timely right after the first of the year, because we start this registration process again every January 1st. Mm-hmm. Because, as you know, situations change throughout the year.
Right.
Unfortunately, you do have deaths, but from the opposite side of that spectrum, many people's condition subsides and they're able to resume a more normal function.
Well, and people move, and there are many reasons why you restart the registry. The bottom line here is people who are watching, people with disabilities, family members, and others, need to get on that 211 list if you will need help evacuating during an emergency. Simple as that. Call 211 now and register. It may save your life. We're going to take a short break here from Focus on Abilities. We'll be right back with more with Terry Moore, the Emergency Office Management Deputy here in Houston. We'll be right back. Stay tuned. Thanks. Welcome back to Focus on Abilities. I'm Lex Frieden, your host, and we're here today with Terry Moore, the Deputy Emergency Management Coordinator for the City of Houston. Terry, we've talked about preparing for disaster, preparing for evacuation. People need to be on the 211 registry, on the list to get out in case they need help. But there's other things people with disabilities need to do before a disaster. They need to make sure they have plenty of water and food like everybody else if they have to weather in place. I think weather in place is very important. We learned that after Hurricane Rita. Everybody shouldn't try to leave town. If they do, then everybody gets stuck on the highway. Right. So we have to depend on you to make a judgment, probably in consultation with the Weather Service and others, about telling us when and where to go if we need to evacuate. That was managed, in my opinion, much better in Hurricane Ike than it had been before that, because obviously you learned from the experience with Hurricane Rita. But for people who have disabilities and chronic care needs, they have to be prepared to weather in place for an extended period of time. That means batteries, food, water, the other things that people should be prepared to have. But it also may mean coordination with caregivers. If family members need spelling, they need to check with neighbors or other family members that might be able to help provide that assistance. And it may be that some caregivers are evacuated and others are left, so there needs to be all kinds of backup plans. These are plans that you and that our city can't make for people. People have to make these plans themselves.
You're absolutely right, Lex. And one of the big differences when we look at individuals with special medical needs that we try and emphasize beyond the normal preparedness of canned food, can opener, bottled water, the basic sustainment goods, is we try to emphasize a buddy system. And you alluded to it in the sense of understand who the people are around you and have backups and contingencies in case your primary caregivers are not available to assist you. Who in the immediate area can be that buddy to help get you the assistance or sustain you during this period of disaster.
But the team has to be prepared.
Absolutely.
Just having a buddy without preparation won't do you much good. One thing we're trying to avoid by encouraging people to do that is to avoid overloading the hospitals and the clinics and whatever other emergency services may be available to respond to a disaster. Once a disaster occurs, we don't know who's going to be hit or how bad they're going to be hit and how these resources maybe need to be used. And we can't really, well, we have to do everything we can to avoid overloading them with folks that could manage themselves if they had prepared properly, right?
Absolutely. I mean, when we look at the greater Houston area and the upper Texas coast as a whole, when we conduct an evacuation for a large hurricane approaching the upper Texas coast, there's between 19 and 40 hospitals and between 40 and 100 nursing homes that need to be evacuated as well. And add to that the ever increasing acuity of home health care. It creates a tremendous complexity for who needs to leave, and it puts a bigger burden on the individuals who are staying behind, who are listening to the message and say, I'm out of the storm surge, I'm not in an evacuation zone, I'm going to ride the storm out here and then look and see if I need to leave post-storm. Or is the storm going to miss us? Mm-hmm. Is the power going to be off and then back on? Or is it going to be a situation much like Hurricane Ike, where we have pockets of the community without power for 2.5 weeks? It requires due diligence and a tremendous amount of preparedness on this population.
Well, and these are things that sometimes we can't be prepared for. I know before Hurricane Ike, personally, I had all my batteries charged. I was ready to manage for 3 days, and the power was off longer than 3 days.
Absolutely.
We had a lot of people in the community who were prepared, even people whose lives depend on generators to in a case of an emergency, to power their ventilators. They couldn't get gasoline for their generators because the power was off at the gas station and couldn't pump the gas. There's a lot of things to think about.
Absolutely. It's been interesting because one of the efforts that we've been trying to work sort of in conjunction is looking at our convenience store owners and the retail establishment of providing fuel and food services, and getting a better understanding of what their capabilities are. When we do this after every disaster, we go back and we look at, well, the term essential personnel is an ever-changing dynamic. You can easily associate it with our police officers, our firefighters, our public works, our health department staff. Those are easy.
Right.
But the 17-year-old pimple-faced kid that's behind the McDonald's counter when you're hungry is a pretty essential employee.
Absolutely.
The gas station operator when you're in need of fuel becomes a very essential employee. And every one of these disasters forces us to look at that definition in a little different light and brings a new gap to the forefront.
Well, I guess in the case of being able to get fuel for powering generators in the case of electricity loss, that fuel provision chain becomes an issue for planning that we really have to seriously look at.
Absolutely. When we look back at Hurricane Rita, one of our big gaps was simply fuel volume. We didn't have enough gasoline at the stations to accommodate the evacuation that we saw. So we worked very hard in 2006, 2007 to ensure that we had an adequate supply of fuel at the delivery point. Well, we did.
Terry, the issue of the power is one that I think is going to affect people whose lives depend on it more than anything else.
You bet.
And recovery, it's going to have a great impact on what we need to do to help people. What can we do now? How can we advise people to be prepared other than get their batteries charged? Would it be prudent for some people whose lives depend on power to plan to evacuate even when they see a storm in the Gulf?
Well, that's one of the things that we're looking back on, Lex. And as we look at the 211 registry, one of the questions is, do you utilize or do you need power? And that question is probably a little more generic than what it should be. Do you require power for life support equipment? Is probably a better question.
Yes.
Do you require power for mobility? So changing one question into two may yield better answers. But to look at that population and see, when we look at the evacuation, we really focus on the evacuation areas. But what Ike has taught us is we may need to look at areas beyond just the evacuation zones for people that have dependencies for life support equipment. And that's our whole job, and everything I've been raised to do is to reduce morbidity and mortality, to protect life. And this gap analysis that we do following every storm is critical to that success.
So we're really in the process of trying to figure out how to help people. One thing that we should do before this program ends is provide people with some tools to do research, to find answers. One website that I want people to look at is disability911.org. And that's a very important site that's been put up by the University of Texas Health Science Center and the Institute for Rehabilitation Research here. Disability911.org can provide you with some links and some useful information if you have a disability, if you're a family member, or even if you work in the field of disability assistance. Terry, what's the website, the Houston Emergency Office website address?
It's www.houstontx.gov/OEM. And our emergency management logo is on the main City of Houston page. If you click on our logo, you'll get to us.
Or if you want to Google, you can just Google Houston Office of Emergency Management and get right there.
Absolutely.
Any other resources that people should be aware of?
Well, you named the big one. I agree with you on Disability 911. That's for this population, that's a tremendous resource, and they've put a lot of thought into empowering the abilities of individuals to gain information.
Okay. There's also a discussion forum there that people can send in information. Before the program started, or at the beginning, we said we wanted to let people know how many were evacuated, before Hurricane Ike, and the number was 3,000. We mentioned it before. We know that there are 30,000, 40,000 people in the Houston area who may need that kind of assistance in the worst case disaster, and perhaps that many who need power. These are issues that you must plan for if you have a disability. You must help others if you have a family member who has a disability. And we can't depend on public authorities, despite their aim to do everything they can to save our lives in a worst case scenario. They'll do everything they can, but our best hope for success depends on our own ability to plan and be prepared. Terry Moore is the Deputy Emergency Office Coordinator for the City of Houston. Terry, thank you so much for being on the program today.
Thank you, Lex. I appreciate the invitation.
And I want to thank all of you for watching this. Thanks to the Community Houston channel for putting this show on the air. It's important for all of you who are watching to be prepared for disaster. We live in a disaster-prone area, and we need to be prepared. We need to be resilient, and we need to be always attending to the potential of disaster in our community. Thank you all for watching, and please join us next time for more Focus on Abilities.